Hi everybody, my name is Joshua Goldstein. I'm a licensed acupuncturist and I've been working here in acupuncture field for 21 years. I do balance method acupuncture which I studied with my beloved teacher Dr. Tan for 15 years. I prescribe Chinese herbal powders and make dietary and vitamin recommendations, and I'd like to share with you in my 6th video a case concerning lower back pain and a Parkinson's patient. Now, the patient was 74 years old. She had really severe pain in her legs, primarily in the right, and the pain occurred on the right side of her body and radiated down into her hip, into the back of her knee, into her calf, into the front of the leg, and she had pain and numbness in the foot as well as complete numbness in the right toe. She came in stooped over. She used a walker to come into the office, and she walked very slow and unsteady. She also mentioned to me that these problems were causing her trouble sleeping and that it was worsening her Parkinson's disease. In Parkinson's, resting tremor or shaking is one of the primary issues that people see with that, and her tremors would just shake even more intensely as the pain would increase. The pain was a constant. The pain was a 10 out of 10. She said she was taking gabapentin, 300 milligrams a day, twice a day, naproxen, Tylenol, and ibuprofen. She said she had gotten an epidural injection. This is her second one, but she only had 20 to 40% relief between the medication, and the epidural wore off after a week, and the second one did not work. She also had severe pain in her cervical vertebrae, which caused radiating pain into her left side of her neck. This would cause her to have to bend forward to alleviate the pain that she was having there. She also tried hot water showers, which she'd have to stand in for 20 minutes, but the relief was only an hour to an hour and a half. She said that when we tried to examine her, she was very limited in what I could test on her orthopedically, but we did find that she really had no ability to bend forward or extend backwards or to stand up straight. So I treated her for 4 visits. I started on June 24th, 2020, after our first evaluation. She sat for about 15 minutes, and she said she had relief from the treatment for 6 hours. I then followed up on her on 6/26 and treated her. She actually had relief for about 12 hours before the pain returned. And I also treated her next on 6/29. She said the pain returned to the glute but was not radiating into the leg. But she was also having some pain in her hip. So I was able then to move her hip because it wasn't as painful, and we found that she had some irritation in the hip bursa. So we had to treat both her hip and her back at the same time. We treated her again on 7/1, and she also had relief for 12 hours. And the relief came much quicker. I found that after the 4th visit, once I inserted the needles, the pain went down immediately. I could see the relief in her eyes, and she told me so. The first 3 visits, I literally had to have her sit for about 45 to 50 minutes with the needles to be able to keep the pain down, because as most people experience, if you're having really severe pain, the pain can come, the pain can go, the pain can come, the pain can go. And the reason why that happens is if your body is in a pain cycle and we stick acupuncture needles in, we're literally sending signals to the brain to shut off the pain loop, as well as to bring the body's natural anti-inflammatories, which our bodies naturally make, brings it at high concentrations into the muscles and the nerves to go at work against the pain. And we do it at such a high level that the body can overcome the pain. There has to be a point where we can get ahead of the pain. And so that's why I let her sit, because I don't want to let someone leave if they're still in pain. I want her to leave without pain. And with all these visits, she left without some pain. Now, unfortunately, she only came for 4 visits. I'm not clear why. What I had recommended to her was between 5, probably closer to 15 visits for her to really get the pain down, and then do a few follow-up visits to make sure that the pain did not continue to come back. One of the biggest problems that people have with the acupuncture is they think it works as good as an injection. So one treatment and there's a cure. Now, there are people who do get that, but by and large, people need to get regular treatment and more frequently at first so that they could dispel the pain on a much quicker level, and you can go through the pain progression and get out of the pain quicker. So could she have done more? I think she would have responded better. Did she have a lot of pain? Yes, she did. Now, the other problem was she couldn't lay down on her back. She simply couldn't lay down for that long. So I had her sit in a chair, we propped her up with a pillow, and we were able to treat using this balance method of acupuncture, where we could stick points along the arms and the legs and even parts of the back and the neck to treat the low back. And you say, well, why can't you just go into the back? Well, you can, but it doesn't always work as well as we'd like it to, and we can only hope that when you get off the table, you'll feel better. In her case, she had no possibility of laying flat on her back because it was just too painful. And the thought of putting needles in her back, I think, would actually worsen the pain. So we actually use this method whereby you could stimulate a point in the brain, which then affects a certain area. And the way I like to explain that is changing a light bulb. If you walk into a room every day, you can always go up to the light, unscrew the bulb and put in the light and turn it on. Or you could use something that's a lot easier. Every time you walk in the room, you just turn on the switch. Well, the switch has the connection through the wiring to the light. Well, similarly, when we treat someone with acupuncture, we're literally flipping switches to different areas of your body that were formed when you were like 3 cells thick. And that's a whole nother course. But the bottom line is these connections exist. There are quote-unquote wires that connect to different areas of the body, and utilizing different acupuncture points, we can affect that area. The nice thing about that is she did not have to lay on her back. She could move the affected part and tell me if the pain was less, in which she told me it was. And then we try to treat the other areas that started to glare up, because as soon as I treated her back pain, she was feeling more pain in her leg and her hip. And so then I had to really go after the leg, and we added a few more points for that. And in that way, we could piecemeal cover all the areas of pain. As one area got reduced, we then went after the other secondary area that came out as a result of that. So I think she did 4 visits, but if she continued, I think we could have had 80 to 90% results with her and a few follow-up visits. Now, if you're not sure about your pain or who to trust, who can you trust? And basically, it's people who've had a lot of experience in the field. So I kind of know the progression of what people are going to go. And after treating so many people, I know where they should be or where they shouldn't be with the treatment. So if you're trying to figure out if acupuncture could work for your back or your neck pain, I would say you should certainly come and give it a try, or at the very least have a discussion with a knowledgeable acupuncturist. If you yourself are suffering from something, I invite you to come into my office. My office is located here in Ridgewood, New Jersey. And you can also look me up on acupunctureyes.com and look in the blog page, because there's a lot of information and useful information on acupuncture there. If you'd like to reach me directly, feel free to give me a call at 201-444-7150. And I thank you for watching. This is everyone's favorite acupuncturist saying thanks for watching.